Welcome to Learning Unit number 4. In Learning Unit number 4, we're going to focus exclusively on quality of life. This is especially important in those dealing with chronic illness. So when you get to Unit 4, you're going to see that there are some, again, topic descriptions, objectives, learning activities, assessments. I expect you to read through those because there's a lot of information that I need to provide you. So please click on and read that. Then there's going to be 2 videos that I developed, and I developed them a while ago on quality of life. So if there's a few things that aren't pertinent right now, please disregard. I developed these a few years back, but the content is still essential. So there's going to be part 1 and part 2. And they're both videos that I developed. So please, this is the content like you were in a classroom, a traditional classroom, that I want you to pay close attention to, because there will be some questions from this content on the quiz. So then there is a video that I did not develop. A physician developed it, and it relates to, again, the content in part 1 and 2 about quality of life, especially because in those 2 videos that I developed, I focus on breast cancer because I was a breast cancer case manager at Roswell Park in Buffalo, New York, and that's what I focused on. The quality of life is in breast cancer patients. So these 3 videos go kind of together, but please go in the sequence that I've set it up for. So you watch part 1, then you're watching this video that I did not develop, but is an excellent video, and shorter too, and then part 2. Now remember, you don't have to do these all at once. You don't have to do all your work in one sitting. However, I do ask you to go through the sequence, and sometimes it's easier to schedule some time during the week that you're doing the majority of work so that that information is easy to recall when you go to take the quiz. So then there's the 5 myths of ME/CFS. So chronic fatigue syndrome. And I want you to remember the look that we had at ME/CFS when we were in the first classes, as far as looking especially at myth number 5, but remembering Jay Bren's experience. So then this is the video that I'm going to take out because I want to give you the instructions now in this introductory video, because this is going to be extremely important that you know how to do this, because if you look down here to your discussion, it's going to be after viewing, let's read it. After viewing the videos for this week, and then you're completing a quality of life index questionnaire for your quote unquote patient, and I'll explain it as I go through. You're going to look at different subscales, what subscales your patient show as being of concern. You're going to look at the questions that make up the subscale. You're going to share your graph. You can do a screenshot. However, if you cannot share your graph that you put together, please tell us the results. And then how would you follow up with this patient? What would you share with the patient? Why would you share that? Would you ask any additional questions? What resources or services would you recommend to the patient? And you may want to think back to the 2 videos that I put together for you And what information would you share with other healthcare providers, such as the patient's physician? I realize you're early into the nursing program, and may not have all of the information that you need, but give it a whirl. There is not going to be any replies this week, so your initial post is due by Sunday evening. So that's the discussion board. And I'm going to get to the site in just a minute. So you're going to click on the link that to Farron's and Powers Quality of Life Index. And you are going to see a couple of things. First of all, which you can't see right now, so I'm going to see if I can get this up a little bit higher here. So you can see at the top of the page, there's quality of life index information, questionnaires and scoring, reliability and validity of this questionnaire, and research. First of all, I want you to read the information. Now that's easy enough. So you click on the information, but it's right here. So you can just scroll down and it's very brief, but I just want you to know a little bit about this survey tool, this quality of life index survey tool, questionnaire that's going to assess quality of life. So I want you to know a little bit about when this index was developed to measure quality of life and what they looked at. So just read through this information first of all. Then you're going to questionnaires and scoring, and you're going to come back here as well. So let me pull this down a little bit too, so you can see, well, that's not going to work, is it? So questionnaires and scoring. So when you come to that, you can see that they develop multiple questionnaires based on chronic illnesses, arthritis. There's questionnaires about arthritis in English, different language, cancer, cardiac issues, chronic fatigue syndrome, really a great one to look at. However, please note for this course, and for this class, I want you to look at the generic quality of life index and use that. So you are using that one. So you would click on generic QLI English. And when I click on to that, you're going to see that this is the paper quality of life index that asks 33 questions. Or I'm sorry, yes, 33 questions. Okay, so first of all, it asks the 33 questions. Sorry, let me get here. That says, how satisfied are you with these 33 things? Number one, your health. How satisfied? Are you very dissatisfied, or are you very satisfied, or somewhere in between? A numerical response to that question. How satisfied are you with all 33 of these questions, including your friends, emotional support? Again, you're going through the things you do for fun, yourself in general. How satisfied? Now, after you finish those 33 questions, you go on to part two, which is asking you these same 33 questions, but instead of how satisfied are you, is how important to you is your health care, having no pain. So you've answered these questions. How satisfied are you? Now you're answering how important to you is this. So these are the questionnaires. If you can download these questionnaires, if you can print them out, please do. if you cannot, take a piece of paper and write down S and then 1 through 33. And then put your numerical answer onto this, okay? And then write out on a piece of paper I, and then 1, 2, 3. So that you can answer, because you're going to enter these into a program that's going to complete a graph. So I'm hoping you can print these out, but if not, just use a piece of paper, put S 1 through 33, then put I 1 through 33. And then on each answer, so if it's S3 and you chose 4, then you're going to put a 4 next to it, because you're going to need those numbers. So I hope that's clear. And so let's move along here. And I'm going to pause for a minute. So after you're done with this, I want you to go back, and in the same screen that you were, the same link, this was the generic quality of life index, you're going to see scoring. And you're going to see subscale items, and let's look at that. And in the subscale items, you're going to see what questions make up each one of these subscales. So we're getting a total quality of life score for all 66 questions, 33 how important or how satisfied, 33 questions how important. But you can see when it says how satisfied are you with question 1, your health? And then how important is this? There is going to be a health and functioning subscale. And these are the questions that made up that subscale. Then there's going to be a social and economic subscale. These are the questions. Then there's going to be psychological, spiritual. These are the questions. And then family. So you're going to look at this now, and then when you're done with your questionnaire. Okay, so let's go on. And then we are going to use the Excel scoring program. So no, almost none of us have access right now to SPSS, but the Excel we do. And then you're going to see some instructions, but I'm going to give them to you right now. And a generic version of this scoring program. So if we click on there, and if you don't have Excel, please go to a computer that does, or download it. Every student here at Mercyhurst has access to it. And you're going to see that there is a generic version of the quality of life index. So again, I'm going to make that a little bit different here. You have to download it. So you click on download. Your download is going to be, you don't have to log in at all. It will pop up. I'm going to click on my download, close out of this, and now I can use it. Got to do one other thing. So I know it's a little confusing, but you need to enable editing, right? You're going to be using this. You got to download it and then enable editing. As soon as I enable editing, then I'm going to have this document that I can use. So in it, I'm going to put a name. Just put in a false name. You don't have to put in your own. You might be doing this for yourself. I'm going to show you one that I did for somebody that I was just thinking about. Maybe you're thinking about your grandfather who was just diagnosed with Alzheimer's. Maybe you're thinking of yourself. Maybe you're thinking of another person who has a chronic illness. And yes, we don't always perceive exactly how another perceives something to be, especially when they're living with a chronic illness. But for the sake of this, I want you to go through and either for yourself, so you can just make up a name. So I looked at things based on Jen Bray. So here's where you're putting your responses. Now, when people when nurses and physicians use this index, um, you can use it for before rehab, maybe before they start their chemo. It all depends. You can use it for multiple different times. But today, I'm just going to put in a date. So, and I'm going to do this for Jen Bray. Every question has to have a numerical number. If it does not apply, you have to put in a 0, okay? Or you're not going to get your graph. That's the biggest error people make. The second one is not hitting enable to edit. But so you can see S1, how satisfied are you with your health? That was the question. And you're going to put in a numerical value. Again, if it doesn't apply, you put in a 0. Then, and it goes through 33. So you're only doing this little pink tab. Then the next one is I. That's an I, whether you can see it or not. How important is your health? And I'm going to put a 5 here. Okay? So you go all the way through this, and what it's going to do is give you a graph at the very end of all the questions overall. What does one think of their quality of life? What are the 4 subscales? Which one is going to be the highest? Which one is going to be the lowest? So you're going to save this. Make sure you save it. So file, save. So I am going to do one other thing, and I'm going to pause, and then I'm going to open up one that I have done. So here is a quality of life index, again, the generic version, that I put together thinking, what would Jen Bray, at the time that she made this video, what do I think she perceived her response to? So how satisfied with her health, S1, I would rank her at 1. She was very dissatisfied. But how important is it to her? I would say 6. I think her health it means so much to her. As you can see, this one question asking about children didn't apply to her, so I put a 0. If I didn't put a 0, I wouldn't get the graph. So I just went through all 33 questions for satisfaction, all 33 questions for importance, and I put in what I thought Jen Bray might. So again, our perceptions could be totally different than the patient's perceptions, but for the use of it. So for quality of life index, you're going to get a graph. And now you can see what I think Jen Bray's graph might look like. And you can see it overall, her quality of life is low. It's less than 15. So it's about what, 13, 12 to 13. So overall, she has a very low quality of life because it can be up to 30, right? So health and functioning, extremely low. That's what you're focusing on for this individual patient, that their health and functioning is really what is impacting, the most their quality of life. Socioeconomic, according to what I did, Jen is not employed, so I put a 0 for her employment, and I think this brought it down a bit. But overall, her concerns about socioeconomic, and again, those make up, like, as far as, or I'm sorry, it's socioeconomic, but that includes the social and economic subscale. So that includes questions like friends, emotional support, the neighborhood, home, job, education, and financial needs. So both economic and her social subscale. Still isn't that high, but I'm not as concerned here. Psychological and spiritual subscale was fairly low. So it asks questions such as peace of mind, faith in God, achievement of personal goals, happiness in general, life satisfaction in general, personal appearance and self. That's kind of low too. And then family, she scored pretty high. So I would look at mostly the health and functioning questions, and that might be what I would want to ask Jen a little bit more about. But I know that for psychological and spiritual, we have psychologists at our hospital where we're caring for Jen Bray or administering this. We have social workers, we have spiritual, we have religious people in our hospital that we can call on to see Jen. So I might also be asking her more questions about this area. And if her social and economic one was low, this is where during the discussion board, you're going to hopefully take a screenshot of this or however you can do that, or at least tell us what the scores were for each one of these, for the 4 subscales and overall quality of life. I know I'm getting long-winded here. So you're going to come back then and you're going to come back to your discussion and then your quiz. Okay, so that's going to be, again, no reply because this is not a lot of work, but it takes some time. And it was important that you watch this video to know how you're going to do this. The link is going to be right here. Have a good week, and I hope that's nice and clear to you because this is an excellent tool and it is used in clinics and outpatient facilities. So it is a wonderful tool.